Good morning, everyone. With recent news of more confirmed cases in Pennington County, our approach to safety and understanding what we can do to keep ourselves, our employees, and our customers safe it's never been more important. So there are many elements, as we know, that are out of our control, but our response to the coronavirus is something we can control. So this morning, we're going to hear from Reese and Kayla Jore. Sarah is with Polk County Public Health, and Kayla is with Pennington County Public Health. So we have the experts here with us, and they're very familiar with all of the recent and new changes and developments. And this is a perfect chance for us to ask our questions. It can be highly interactive, so I would encourage you to do that. And without further ado, I will hand it off to Sarah and Kayla.
Wonderful. Thank you to Michelle and Antonio for inviting us to participate today. I am Sarah Reese, and as she mentioned, I am the Public Health Director in Polk County, and I also serve as the Community Health Administrator for Polk, Norman, and Mahnomen. What you can't see on my screen is I also have one of my colleagues, Angel Corinta, in the room with me, and she is a content expert. And so she and I have differing backgrounds, and so we listen with different lenses. So she will be here, and if her or I or Kayla can't answer your questions, we will certainly get back to you. Also, I want to just take a moment to recognize the important role that business plays and the role of your workers and also of your patrons. And so really appreciate your time today to visit with you about your response in this phase 3, they're calling it, of the Stay Safe and the Reopening Initiative. And also want to just quickly recognize that I do live in your shoes. Both Angel and I, outside of our public health roles, run family-owned businesses. So we have small businesses that are located in Polk County and the surrounding area. And so many of the topics that we will be visiting with you today also have definitely a special place in our heart because we do have a family-owned business as well. So thank you so much for inviting us here. I'm gonna ask Kayla to do an introduction of herself. If you haven't met Kayla, no time like the present to have an introduction and also to be able to connect with her later related to initiatives directly in Pennington or Red Lake County. Also, as Kayla introduces herself, I would just ask Kayla if you could give all of the folks on the call a brief situational update about what's going on in Pennington County based on the data, and then I'll take it back and talk about some of the business pieces and a little bit more of word on the street kind of feedback, and then we'll open it up for questions. So Kayla, take it away.
Okay. All right, thank you for having me on this call. My name is Kayla Jore, and I am the Public Health Director for Pennington and Red Lake County. And I have been in this role for just a bit over a year. So currently I will talk a little bit about Pennington County. We've had a significant increase in cases over the last couple of weeks. So it was related to a workplace outbreak. And as of today, we're at 51 cases. However, only one active case that is currently still in isolation. So we did update we have a Facebook page that we do a daily update on. So I'd encourage you to look at that at Intercounty Nursing Service. So we were able to put a little bit more information on there as far as our active cases versus recovered cases, which is helpful for the community to know. So I think we've had the community spread and then kind of for a few weeks now, and then this workplace outbreak. So that's kind of what's going on currently in Pennington County.
All right, thanks, Kayla. So what I want to do quickly is I've had several questions about what does it mean when someone says we have 51 cases in Pennington County? What does that mean to me? And so I quickly just want to take you through a bit of the what does this mean to me? And so the 51 cases that Kayla is referring to, those are diagnostic lab confirmed cases. And that is a test that's done through a medical provider, and it provides that diagnostic test that shows us that we actively have COVID, we have the COVID virus. One of the things that we don't always talk about or isn't easily described when you look at the diagnostic cases is the everyone else category. And so there's a few things that I want to mention. There is a variety of people in Northwest Minnesota that have COVID symptoms and are, for whatever reason, not being tested. And so I think as a business owner or as a manager, this is really important information to know, because there is a variety of reasons for which people are not getting tested. And so anecdotally, I'll share a few reasons with you. So number one is the CDC, the Minnesota Department of Health, various resources have said, if you have mild symptoms and you feel that you can manage it at home, go ahead and do that. And so some people say, I have mild symptoms, I think it's COVID, I know I've been around someone who's been COVID positive, or whatever the reason may be. And so they have mild symptoms, and so they feel that they can manage it safely at home and don't need medical care or don't wish to have that diagnostic test. There's other people that are not receiving the test because, unfortunately, sometimes there's a stigma around having the test. And I'm not saying that because I think that, I'm saying that because people have actually told me that they're not getting the test because they have a community stigma associated with it, or that is their perception. And so there's a whole host of reasons why people are not choosing to get tested, but maybe having the COVID symptoms. And then there's also folks who we have seen who have tested positive for COVID, but are asymptomatic. So that's important to talk about, because typically when we do that diagnostic test, it's sometimes called the PCR test, the test where I was initially talking about the 51 cases. There has been, most people get that test when they have symptoms. They're experiencing symptoms of COVID. So there's a broad range of symptoms, and then that is leading them to get the test. Well, what we are finding and what we are seeing is, while there's people who have symptoms of COVID getting the test, we are also seeing right here in our region people who are testing positive who are asymptomatic, meaning that they don't have any symptoms, but they still are showing that virus. And so it's really important in terms of thinking about our business strategy, in that there are people in our community who may be positive for COVID, who may in fact be infectious, but not showing those symptoms outwardly or feeling sick. And so that's one of the things that makes COVID a little tricky, right? It's a new virus, and so we're still learning a lot about it. Then there's this fourth area that sort of pivots a little bit, so I want to just talk about that for a moment as well. There's a testing strategy called serology testing, and serology testing is a simple blood test, and serology testing is looking for if someone has been exposed to the virus. So this would be someone who is currently well, but is wondering if they have been previously exposed to the virus. And what we know from the information that's currently available to us is that if someone has been exposed to the virus, so it shows up on that serology test, what we know right now is that there's this short-term immunity. However, because it's a new virus, we can't verify the long-term immunity. And so one of the concerns that I have from a public health perspective is the perceived notion of long-term immunity if people have had a serology test. So I would recommend for people to be mindful of all of the different types of COVID that are COVID-related numbers and information that's out there. So we have the PCR diagnostic test. We have people who are asymptomatic, who are having that positive diagnostic test, meaning they're not showing symptoms. We have people who are not being tested but have COVID symptoms, so they're not being tested for a variety of different reasons. And then we also have people getting the antibody testing, or that serology testing, which is showing if someone's been exposed or not exposed. So you take all of that into consideration, and then you insert community culture and values and business practices, and it creates just this array of things for you to consider, or us as also a business owner, to consider when we are making plans for how we're going to safely reopen. And so on the Stay Safe Minnesota site, there is the Employer Preparedness Plan Requirements Checklist. And I'm not going to go over every single item in there. I just want to jot over to it quickly to show you in case for some reason you haven't been there. All right, Antonio, are you seeing that guidance from Stay Safe? Okay, I believe we're seeing,
Yep,
Antonio. Okay, great. So this is guidance that came out on June 3rd, so you may or may not have seen it yet. And there is just a few things that I want to point out. And the reason that I went over a little bit more in depth about diagnostic testing, about asymptomatic individuals, and about the serology testing, and about people not being tested, the reason that I gave that as the foundation for the conversation is because it's really easy to gravitate to a conversation around people who have a positive diagnostic test, and that's where we focus our energy on. And as business owners, I'm asking for you to think about it more broadly. And so there's a variety of items that are in this checklist, and I want to just talk about a few of them. And so I'm going to walk through that, and then I'm going to spend most of my time talking about consumer confidence, because I have a few examples to share with you about consumer confidence and increasing consumer confidence. And I also just have a few tidbits that I've heard of as I've been talking with individuals in the business sector. And so I want to share a few of those, and then we'll have question and answer time. So in the first section about ensuring worker protections, I think one of the things for consumer confidence is also about worker confidence. And so one of the main areas that I want to point out on this page is really about health screening protocols. So it's really important. People want to come to work, people want to work, and people want to do that safely and be healthy doing it. And so a health screening protocol is something that should be established. And one of the areas that I've provided a lot of consultation around is around temperature taking. And so I want to give you a few things to think about when you think about taking temperature. Number one, if you're going to do a health screening, I would highly encourage a self-screening to happen prior to the employee coming to your place of work. And so considering what kinds of questions need to be asked. So for example, have they had any COVID-related symptoms in the past days? Do they have anybody in their family who has COVID or is recent COVID family or household that has COVID or has recently been tested? Has that individual themselves recently been tested? Those are all kinds of screening questions that can be considered. And one of the things that you will see here on the worker protection around health screening is related to that temperature screening. So one of the tricky things is I would recommend that we don't rely on a temperature screening as the primary screener. And the reason for that is because what we're finding is that the fever is usually a later symptom, not an early symptom. And so what I would more recommend is to focus on those mild symptoms that on the symptom screener list, which is available through the link on this document on page 1, and to really focus on mild symptoms more globally on that checklist that's provided, versus relying on a temperature screening as your primary screening source. So that's a little tidbit related to fever and related to temperature, where we're seeing the temperature being a later symptom. I think it's really important for you to communicate with your workers what your expectations are and how you're going to operate your business, because knowledge is power. And so if your employees are part of establishing what your protocols are going to be and what those protections are going to be, they know your clients, they know your patrons, and so ask them for input, have them be part of the solution, and also make sure that we're communicating that information with them. Number 9 talks about high risk and vulnerable populations. So if your workers are 65 and older, or if your workers have a variety of different health conditions or have a compromised immune system, it's really important for you to be mindful about what their current job assignment may be and how that may look different from what it would have been maybe in the past. One other thing that I want to just go back to is that if you're going to do a temperature screening, to make sure that you're following the American with Disabilities Act and also HIPAA related to how you take that data and how you use that data. That's really important, and typically needs a lot of thoughtful planning and preparedness if you're going to do any sort of temperature screening. Then I want to just point out a few other things. On page 2, there's a section about social distancing, and that 6 feet of distance is really important. And people say, well, why 6 feet? Why not 12? Why not 3? And the 6 feet really gets around the droplet precautions, because we know that when people sneeze or cough, it's really that 6 feet of distance. And so one strategy that I have done for myself and have recommended to several businesses is to be really intentional about how you place yourself. So we are creatures of habit. We're creatures of congregating in certain spaces in your business. Think about your business and think about where you spend your time. People spend their time at the copier, they spend their time at the front table, they spend their time at the crux of where 2 hallways meet. And so if we can think about where people naturally spend their time and congregate, that social interaction is really important. But if we can help people with visual markers, maybe it's signage, maybe it's verbal reminders. And if we can also train our brain that when we are in proximity of other people, that if people are stepping toward us, we step back or we step to the side, and all being mindful of that 6 feet distance, because really those little things can go a long way. Also, I think it's important to evaluate your traffic patterns about how people maneuver through your space. Do you have a business where a lot of people come to your space, or do you have a business where you go to other people's space? So for example, the industry that our family-owned business is a service-related business where we go to people's home or we go to people's businesses. And so that kind of traffic pattern looks different. And so we have to engage in a conversation up front as opposed to having signage or something else on site. We have to engage in that conversation about spacing and about precautions that are being taken relative to the place that we're going to be going to ensure the safety of both our employees as well as the person that we're going to be providing that service for. Next below is the information about worker hygiene. I think it's really important to think through cloth-based coverings. So for example, if I wear a cloth-based covering and Antonio comes to my business, my cloth-based covering is protecting Antonio. And if Antonio wears a cloth-based covering, his covering is protecting me. And so I think it's really important to remind workers that when they wear a cloth-based covering, that's really protecting your patrons, not necessarily protecting themselves. And so there's a lot of misperception or community culture that if I wear the cloth-based covering, then it doesn't matter what my patrons do. And so it's really important to provide that education to your workers about cloth-based coverings. And it's also really important to teach individuals how to don and duff a cloth-based covering. And so what that really means is, how do we put it on and how do we take it off? We need to have good hand hygiene before we put it on and when we take it off. And when we are donning it and duffing it, or putting it on and taking it off, it's important that we grab it from the back loops as opposed to putting our hands all around the cloth-based covering, because then we are spreading germs by touching the cloth-based covering. So providing some education to your employees about the proper donning and duffing and storage of a cloth-based covering and laundering is really important. One of the things that I always recommend around cloth-based coverings is not to use the same one each day. So you can kind of think about it like underwear. You need to wash your underwear after you use it. And so think of a cloth-based covering the same way. We want to wash it after we use it. If it gets soiled during the day, we want to get a new one. And so if, for no better example, you can think about it in terms of underwear and have a little humor, cloth-based covering and the laundering of them is really important and should be built into your communication with your staff. It's also important to remember that not everybody can wear a cloth-based covering. And so it's really important to be mindful to respect people's wishes, as well as to respect people's wishes if they are wearing them or if they aren't wearing them, and to be a good steward. I think of it as follow the leader. So if I am in a business and I walk in, people are taking the temperature about what the business is doing. And so we're going to talk about this in a moment, but it's really important to set your expectations very clearly before people enter your building. When people enter your building, it's important to exhibit the behaviors that you want your consumers to do. And most people will, quote, follow the leader. I think about it as my 5-year-old. If I'm wearing a mask, he wants to be wearing a mask. If I'm washing my hands, he wants to be washing my hands. Or sometimes he doesn't want to wash his hands because he's 5, so they want to go a different direction. But nonetheless, follow the leader. When I have walked into businesses in the last couple of weeks, I instantly am looking at the employees in that business to see what kind of behaviors that they are modeling. So it's really important for you to think about the type of business that you have and the interactions that you have and what kind of personal protective items that you need to have, whether it's a physical barrier or whether it's a cloth face covering or what that might be. And I think it's really important to remember that when you think about your exposure risk, so now I'm going to get a little public healthy on you for a moment. When you think about your exposure risk, if you are a garage or a shop, let's say you have 2 guys that are changing a tire. If those 2 guys are changing tires all day long, they're in close proximity to each other, and if those 2 guys are wearing a cloth face covering and having good hand hygiene, trying to keep that distance as much as they can, they are significantly reducing their risk. So little steps on the front end can save on the back end. And you might say, well, why is that? Because if one of those individuals happens to be one of the individuals I described earlier who is asymptomatic, but for some reason is tested for COVID and is positive, when we call from public health, one of the very first questions we're going to ask you and we're going to check in is, were people wearing cloth face coverings? Were people keeping distance? We're going to be assessing their risk based on their different exposure. And so instead of having to send home a multitude of different people who may need to be quarantined, we may be able to just have people continue in their work environment if we take those little preventative steps on the front end. So again, it's ultimately your decision, but it's important to think about the what if. So if I don't actively lead, and if I don't actively promote cloth face coverings, and if I don't actively promote social distancing, and we do have someone with COVID, then what does that mean for my business strategy? Does that mean I'm going to lose, that there's the potential to lose a multitude of employees because of the proximity for which they work or the type of service that they do? So it's really important to think about it more broadly than just in the moment. I will also mention in this section down here on page 3 about workplace cleaning and disinfectant, one of the areas that I will prompt you to think about is if you have any type of delivery vehicle, or if you have any type of service vehicle, like a service truck or like electrical, plumbing, etc. It's really important to think about who's going to spend time in that vehicle. So if it's a delivery vehicle, like a pizza or flowers, who's going to be spending time in that space, because it's going to be really important that you make sure that if there's a change out in drivers, that there's a process to clean and disinfect that space. And that's not something oftentimes we think about. I just had a conversation last week with a business and they said, oh my goodness, I didn't even think about my delivery vehicle. And so it's really important to think through what that cleaning and disinfectant plan might be. And I think it's helpful to have a little bit of a checklist for folks, because otherwise people forget, like, okay, when I get in and out of the vehicle, I should do what now? And so making sure that those cleaning materials are available, as well as having a checklist of expectations of what that looks like, because people don't routinely clean when they get in out of vehicles. But we have seen in our region areas where in and out of people and vehicles can cause tricky situations as it relates to COVID. So just want to kind of point that out there when we think about workplace cleaning and disinfectant, keeping in mind that cleaning is different than disinfecting. And so it's important that we do both cleaning and we do disinfectant. And there is EPA list for Environmental Protection Agency, excuse me, I get alphabet soup here a little bit. There is lists of disinfectants that meet the criteria to fight against the SARS-CoV-2 virus. So if you haven't seen that, that's on the top of page 3. There's a link where you can check your items that you use. I think that it's really important from consumer confidence perspective that individuals visually see you cleaning and disinfecting and being mindful in your business. Do you need to do it every hour? Does it need to be over the top? No, but people are being highly aware. I have heard of individuals who have said, you know, I'm going into local businesses and I'm not seeing any signage. I'm not seeing, there's no information given to me ahead of time about like how this business is going to operate. I'm not feeling overly comfortable. So I'm going to a bigger box store. That's obviously not the answer, but that is the reality of things that have been shared with me. And I, like you, want people to keep it local. And so cleaning and signage and some of those very visual prompts are important for consumer confidence. And I'm going to just talk about that in a little bit more detail in just a quick moment here. I think another important thing to talk about down here on page 4 is talking about minimizing the risk of transmission. So this is going to be an example of a photographer. If you're going to do photos, or if you're going to provide a service, to think through how you can provide your service so that you can do as many things as you can, either by phone or remotely, and to minimize your time that you actually have with the client. So for example, in photography, where you might typically spend an hour together and you might be in super close proximity, is there a way that you can spend a little less time, like maybe 15 minutes together, or you might just rethink how you're spending your time together, or rethinking if you're going to spend a longer time together, how are you going to take pictures from a farther distance? How are you going to capture pictures maybe outside versus inside? And so there's a lot of ways that we have to adapt our business right now, and we have to be a little creative to think about how we can minimize transmission, because the time for which we are together really gets at that exposure and that risk of exposure to the COVID. And so really, if we can try and keep those interactions around 15 minutes, that's really ideal. Some services take longer, some would take less, but if you can think about like, how can I get that to be around a 15-minute mark, that would be an ideal standard. Obviously, not every retailer service business can provide their service in 15 minutes. And so then we have to consider additional things. Let's see here. So now I'm going to go down to here. This talks about protections and protocol for managing occupancy. And this is specifically where I want to talk about. This number 4 says advertise business protocols so the current and potential clients are aware of your changes. So the most important thing I can tell you is do what you say you're going to do. So I had a call just earlier this week where a corporate business site had on their website, our business has a high value on protecting our staff, protecting our visitors, and everyone will be wearing a mask and we will be doing X, Y, Z. Well, said resident from our county went to this, they checked online, read all this, they felt very good about their encounter. They went to this business, this local business, who has this affiliation with a larger corporate entity. No one was wearing masks. No one was keeping distance. It was just business as usual. And this resident was really upset and hurt by that, because this same resident has a lot of medical issues and was completely uncomfortable in that environment, and they trusted it to be a safe space for them to go. So it's really important to do what you say you're going to do, and it's your business. So these are recommendations and guidance, and you can pivot them and you can use them in a way that makes sense for your business. But it's important to communicate that with your patrons so they know what to expect when they're going to come to your business. As I said earlier, knowledge is power, and we all care for our neighbors. That's the beautiful thing about rural Minnesota is we care about our neighbors, we care about our community, and we care about our fellow businesses. And so part of caring is to show people what the expectations are and how it's going to be when they come to your business or when they request your service. And because COVID is, we're all learning and growing, each business might have little different nuances in how that they are going to do their business. And so all the more important that we help consumers know the lay of the land before they come to your business. And so I think it's really important, this items on page 5 of this checklist are really important to talk through or to think about what your stance is on these different areas. And to encourage how you want consumers to behave. One of the things that I want to point out is on page 6 here, and this talks about, as I was mentioning earlier, reducing face-to-face interaction. So how you can keep things top of mind in terms of space, how you can keep physical barriers or other barriers top of mind if that's appropriate for the type of retail environment that you have. And keeping it top of mind both for your workers and for your patrons is really important. And on page 6, there's some very handy examples of things that you can do in your business to show your patrons that you care about your workers and that you care about your patrons, and that increases consumer confidence. So simply an example of having hand sanitizer at the entrance. Some people everyone has a different experience to how they relate to COVID. So for example, some people think that COVID is nothing, it might be a hoax, and feel very strongly in one direction. Other people, their experience is they maybe never want to leave their home again, they're scared, they're what have you. We have individuals who have been positive with COVID, as Kayla described. We've had individuals in Polk County, for example, unfortunately, that have passed away. We have many individuals that are older adults or have compromised immune systems. If you've recently had a liver transplant, you're going to have a much greater heightened awareness for where and how you spend your time. And so it's really important to be able to think through the array of patrons that you have. So you might have somebody who thinks this is nothing, not a big deal, hasn't experienced anything related to COVID. They've been going on their daily business since March, like all is well and life is peachy and today's sunny and it's great. And so they might see the hand sanitizer at the door and be like, okay, it's there, whatever. They might just pass right through it. You might have someone on the other end of the spectrum that they themselves had COVID, a family member has had COVID, somebody has a compromised immune system, and they may really appreciate that hand sanitizer there. And it's an instant visual cue about your business's obligation to protecting the health of the workers and the patrons, and that does increase consumer confidence. And of course, there's several other considerations in here that are mentioned as well, and I'm not going to go into detail of all of them because you all can read, and Kayla and I can certainly be a resource. So I want to just talk about consumer confidence. So I'm going to get off of the sharing here. So I want to just give a few examples about consumer confidence and things that I think are important for us to think about in terms of what I'm hearing in word on the street. So again, like I mentioned, do what you say you're going to do. I think it's really important to think through how you're going to protect your patrons and your workers, and then letting people know that. Do you have a website? Do you have a social media mechanism? Do you conduct pre-appointment phone calls? How do you engage with people who are going to be patrons of your business? And what are you communicating them with? So do you typically communicate electronically, visual media, etc.? And to think through what you're letting them know so that they know when they engage with your business what to expect. I think that's really important. Then the second piece is if you have a a business that has a retail environment where people are going to come to your business, when they come in that door, they should also have some of those same messages, right? So messages such as, if you are ill, to come back, to reach out to us a different way. If you need an accommodation, if you don't feel comfortable coming in the door, if you'd rather have curbside or delivery, how to make that accommodation. Also, to just be really clear of your expectations. When you come into this business, this is how we are going to do things. And then the visitor gets to decide what they're comfortable with or what they're not comfortable with. I think it's also important, as I mentioned earlier, to be visible about what you're doing to protect the health and safety. So be visible in cleaning, be visible in hand sanitizer, be visible in markings on the floor or signage, be visible in your communication. Verbal goes a long way. So for example, in the type of business that we have, it's a service business where we, like I mentioned, go into a home. So we have a pre-phone call with the people that we're going into. So we ask them questions. How comfortable are you having us come to your home? What kinds, are there things that we need to know about your health to decide if we should come now or if we should come later? Is there a way that we cannot be in close proximity? I can still do the work, but I'm in the basement and you're on the main level. Is there accommodations that need to be made? If someone's coming into a retail environment, and if you're a kind of business where I would call it onesie twosies, so people come in at one or two at a time and stay for a short period of time, you can certainly engage in a verbal conversation. What are you comfortable with? How can I help you? Keeping that distance. So it's always okay to ask. And I think people appreciate if you ask how they feel about that. If you're a business that's a little bit larger or has larger groups of people coming in, you have to think about those places where people are going to congregate and what you're going to do about that. Are you going to have signage? Are you going to reset up the physical layout of your business? Is that even an option? To promote people to not congregate in spaces. And so there's a lot of little things that don't cost a lot of money that you can do to help prevent the spread of disease and to keep your workers and your visitors safe and confident in coming to your business. So a few things that if you want to think through, like things to ask a customer, if that's a comfortable conversation with you, things like simply asking them, what are you comfortable with? Would you like me to wear a mask? I'm going to wear a mask. Would you like a mask? Did you bring a mask? Can I provide you with a mask? Thinking about how much time you're going to be together. If you're a business where people are running in and out, then you're going to think about that differently versus if you're going to be a business where you're going to be in close proximity for a lengthy period of time. You might need to approach that different. And then also, how close are you going to be to that person? Are you able to keep that distance of 6 feet or more or not? Every business is a little bit different. I think about a bank tellers. I used to be a bank teller, and those transactions are relatively quick. And so the way that I might engage with my customer and the way that I might put out my messaging is going to be very different than somebody who's going to be in a really close proximity for an extended period of time. And so those are all questions that you can ask people, and to ensure that both you feel comfortable as the worker and the visitor feels welcome as well. I do think that it's good to share examples. I'm all about sharing examples. So one local example about consumer confidence and about sharing how you're going to do it and really being visible. Todd Swarry from West Main Pizza in Ada, if you check out his Facebook social media page, so Todd Swarry, West Main Pizza in Ada, he did a video. It's a very short video, and it starts with his outdoor seating and then brings you inside. So you visually, before you go to his place of business, can see what is it going to look like when I walk into West Main Pizza? How is he operating his business during this time? And again, knowledge is power. And so it helps people be able to relate with their comfort and how the business is taking precautions to protect health and safety. So that is a great example about how he gives clear expectations about how his business is set up. How does it look visually? So you can definitely check that out. Typically what we see is the follow the leader concept, as I mentioned. So if you are clear about what you expect, act and you take visible acts, that really goes a long way in terms of how your patrons and how your workers will respond as well. A few other examples about consumer confidence. And Antonio, I'm not sure if you've seen this. This is called an Open for Business pledge, and it's the Iron Range communities. And this is super cool. So have you seen this, Antonio?
It's through the Minnesota Chamber, correct?
I do believe that it has a connection, yes. So it's the Iron Range Tourism Bureau and the Hibbing Area Chamber of Commerce. So they did an Open for Business pledge where they designed a pledge to help customers feel comfortable as they shop, as well as to for businesses to know who's participating and who's committed to the best practices of COVID. And so that's an example of something that you may want to check out in terms of a chamber initiative that could be done, or a visitors bureau, and really just articulates ways that people have maybe altered their routines and ways to ensure safety and health of who they're serving and who their patrons are. So that's one example. There is the Horsey Graphics in New Ulm and Nelson Brothers in Fergus Falls. They have been actively, so they do printing and signage. And so they have been a resource, a local resource to providing those visual cues and markers. And so same thing in our area is, what kind of service do you provide? And so one, how are you going to operate your business in the day-to-day operations that you did pre-COVID? But how are going to be those unique ways that we adapt to this new way of doing business? And that might mean deviating what we currently do in our business so that we can capitalize on new opportunities, just like the Nelson Brothers did in Fergus Falls and Horsey Graphics did in New Ulm, where they took the opportunity that said, people need signage, people need these visual cues. How can we meet those needs? And I will say Premier Signs, who is based out of the Fertile Mentor area, for the county, was a local resource that did the signage for Polk County for our 6-foot markers. And so I think it's always good to think about your business and how you can have a business niche that supports things that are needed for people to feel comfortable as they are going about their daily to-dos. And so those are opportunities that local businesses, small businesses have taken to meet the niche of what we need as we reopen. I will comment on the Shed in Thief River Falls. It's one of my most favorite places. I love Allie, so shout out to Allie. She has definitely capitalized on mental well-being, and I really appreciate her being a fine example, whether it's giving flats of flowers to skilled nursing facilities, or providing educational opportunities that are online based for families and children. I think each business has this unique opportunity to think through what are the opportunities that we maybe have been thinking about but haven't tried in the past, because all people are exploring, what does this new normal look like? And we might find diamonds in the rough that we hadn't thought about before, and in terms of how we do our business. So I would encourage people to try new things, as well as if you have those old but goody things that are your bread and butter, to really think through how you can capitalize on those, because they are your bread and butter for a reason. And so really communicating that piece about keeping patrons safe is important for people to establish or come back to the way that they maybe have done it in the past, because everybody has a different experience. And so really important to communicate that. I want to stop there. I wanted to give a few examples. And on the DEED website, there is also other business examples. So if you're wanting to brainstorm a little bit with your specific type of industry, there are other Minnesota examples that are shared there. And I like to just kind of check in on those to show success stories about how Minnesotans are supporting Minnesotans, because it's quite exciting during this time, and really important that we remain positive, because our rural culture is really important to be supporting each other locally right now. So Antonio, do you have any comments or questions, or anyone else? I'll turn it over to Antonio.
You did a great job. We appreciate all the information. Consumer confidence and safety, I think, are going to be very I know are going to be very important topics going forward. And the communication part is very important as well, to make sure you're getting that messaging out. And I appreciate you for suggesting that idea to promote safety. So I think that's something that we can do to have a pledge for our members and kind of promote that community-wide. And some of the same issues that members of the community brought up to you, I've heard similar situations. So I think I've heard businesses that have provided some of the best practices. They've had great success. I mean, even for those who don't think COVID is a real thing, and those who are very mindful of it, it's still going to be an important piece to be able to continue and conduct business. And it's going to affect business, but you can control that area of it. You can control the flow of your traffic. You can control the safety, but your business model will have to change. You know, you may need to still provide curbside delivery services or a website. So just some things to think about. So if anybody has any questions to ask Sarah, and just open up the floor here.
And Kayla, while we're just checking in, did you have any closing comments? I wanted to just kind of round back to you.
No, Sarah, you did great. You're a very good teacher. So, you know, and I've worked with just a couple of businesses in Pennington County, but if anybody has questions locally or just wants to review their plan or have questions along the way, just please feel free to reach out to me here at Inter-County Nursing Service, and I can sure answer any questions or provide any input.
Thanks, Kayla. Do you want to go ahead and put your contact information into the chat box? If you could, please.
Yes, I can do that.
One other thing I wanted to mention, when you think about our demographics and other rural communities, we have a larger elderly population, and some rural communities don't have the great hospitals that we do. So when you think about that, the impact could be more severe in rural areas because of that. But we can control how we handle this, and I know community-wide we can do our best as a community. So, and Kayla's information is in the chat box, so you can see that there if you have any questions and want to follow up with her. Again, I want to thank everybody for joining us. This is great information. And if you have any questions for us as a chamber, feel free to give me a call. I know many of you on right now already have my information. So thank you guys. I appreciate it. Thanks, Sarah. Thanks, Kayla.
Yes, you're very welcome. Thank you to Michelle and Antonio for the invite. And Kayla or I are certainly a resource. Every situation is different and every business has different things that are specific to your business. So if you have questions or just want to vet ideas, Kayla's literally only a phone call or email away. So certainly lean into those resources right now. Don't feel like you have to figure this out all on your own, or if you want to strategize an idea, I think you have the opportunity to be a good role model for your community and for your patrons. So thank you so much for your investment into Northwest Minnesota and Pennington County.
Thank you. And then just to put a plug out there for next week, we're going to have a panel of local lenders on our next week's webinar, next Wednesday at 9 a.m. So that will be a great opportunity to hear from the bankers side on how they've been supporting our businesses from PPP programs, state, federal programs. So, and then an opportunity for you to ask questions. So tune in next week, and we look forward to having you again.